Welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly webinar series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we're going to be looking at how to build and share custom data dashboards in hawaiihealthmatters.org. So here's an example of what a dashboard around bullying might look like. This dashboard shows you values for the state, but I'll show you how you can make a dashboard that's specific to different geographies, topics, populations, and data sources. Okay, but just a little background on Hawaii Health Matters first. So Hawaii Health Matters, or HHM, was launched in 2009 to provide a user-friendly way to access community health data for the state of Hawaii. It's powered by Conduit Healthy Communities Institute, who also maintains many of the indicators in the system. And right now we have over 800 health indicators taken from 50 different data sources. And whenever new data is published for one of these data sources, the relevant indicators in HHM are updated. So we maintain the site with the most recent data available for each indicator. For most of the indicators, the data is available at state and county level. For a subset, there's data at smaller geographies, including primary care service area, census place, zip code, and census tract. And where the data is available, estimates are shown by selected sociodemographic characteristics such as sex, age, or income. Indicators can be viewed individually in trackers or grouped into custom dashboards. If you want to see an example of a data dashboard, you can check out any of the 9 data trackers we currently have on HHM. So these are custom-built, curated dashboards around a given topic, such as oral health or cancer. But what we're going to focus on today is how you can build your own custom dashboard tailored to your needs. I want to go over a couple things before we launch into the demonstration. First, I'd like you to note that there are 2 approaches to building custom dashboards. The first is by using filters. So here you can see the 7 different filters available for you to customize your dashboard with an example of one of the selections for each. And I'll show you these again and show you some of the other options that are available during the demonstration. The second approach is to handpick your indicators, and this is based on the indicator name. So type in your topic of interest and it will show you all the indicators that have that in the name. And then this method also includes some filters, but not as many as the first method. And then I also want to show you the different display options for your custom dashboard. You can group by indicators, which shows you the data for all geographies available for each indicator. So you would see the state data for the indicator, followed by the county data, followed by any smaller geographies for which the data is available for that specific indicator. The second option is to group by location. So this separates out the geographies. So you would see the data for all the indicators at the state level, and then data for all the indicators at the county level, etc. And a third option is to show the indicator location summary. This shows you your selected indicators and the geographies that they're available at. And then last, you can also modify the ordering of the indicators in the dashboard. So default shows them alphabetically, but I'll show you some other options. Before we go to the demo, I just want to go over some basics for people who aren't familiar with Hawaii Health Matters. It's a great source for data when numbers might not be your first love. It provides a lot of comparison data and links to resources that help you put the data in context. First, the site uses comparison data and icons that incorporate colors and symbols to help users interpret the point estimate. So in general, red is bad, green is good, and blue is neutral. When you see a solid box with an arrow, that tells you there's a statistically significant trend. When the box is white, it's a trend, but it hasn't reached statistical significance. And many of the indicators on HHM also have target values, and you can see which ones have been met with the green check and those we still need to work on with the red X. Okay, so here is our homepage. And you can see, for those of you that aren't familiar with the site, this is our rotating banner where we show featured content and announce new data uploads. And this is also where you can register for the coffee break. So come back later and register for August coffee break. You can also click here for more information on how to use the site for anyone that needs a little extra assistance. Okay. So we are going to focus up here on the find data in the community dashboard. So the community dashboard is a great place to start searching the site. You can search all the indicators by keyword. You can also find an indicator by its title. So you can type in words and any indicators that have that word in the title will show up. And you can also filter by location. The rest of these tabs down here are links to our data trackers. And I'm going to show you one real briefly, just so you can get an idea. This is the Child and Family Mental Health Tracker. So we see some information here, and then we get into the data organized by topic area. So what you'll see, if we look at, for example, teens with recent depression, you'll see the most recent point estimate, a comparison to the US value where it's available, a comparison to the prior value, and then here's that trend. So real briefly, I just want to show you what each individual page looks like for people who might not be as familiar with the site. You've got the definition of the indicator, a little bit about why it's important. You have those data values that we saw in the tracker. And then in addition, you can see the data trend over time and by specific subgroups. So in this case, we can see the data by grade level, by race, ethnicity, by sex, and by sexual orientation. And you can see the system actually does some basic statistics for you. So where you see a red bar, it means that that subgroup is significantly worse than the state overall. And the green is significantly better. So you can get quite a bit of information. And then the last section here is the geography. So in this case, you can see the data here by county. It ranks them and shows us a nice map. So there's a lot of good functionality on here. But let's go back to our community dashboard. So in order to build your own dashboard, it's in the advanced search. So we click on here and now we can see building a custom dashboard. The default will give you the option to build your dashboard by using the filters. So let's take a look at these filters a little more closely. There's a filter by location, which again, you can choose a specific location if you're interested in just one area. You can filter by topic. So the whole website, Hawaii Health Matters, is all organized around topics and subtopics. So for example, for the health topic, we have all of these different subtopics. And then there's a community topic with all of these different topics and economy. So there's a lot that you can use just to see. So for example, if we were interested in diabetes, let's just take a look. So now what we'll see, and I'm showing this grouped by indicator. So if you remember, that means that it will show all the data for each indicator by geography. So for here, we're looking at, for example, adults 45 plus with depression, and we see our state data and our county data. And then the next one is adults who bought medication for diabetes. And we can see our state and county, and this one has data at the census place. So that's going to be a really long list. If you want to, you can group by location. This is the alternative. So this will show you the data for all of the indicators by state first. So you can see here all of the different indicators that we have around diabetes, quite a few. And then it will go into the county, and then it will go into the primary care service area, etc. Okay. And I definitely want to show you how you can save this search. If you click here, it will give you a URL that's specific to this dashboard, so you can share it with people. You can come back to it later. And the nice thing is it's not a static dashboard. So if you come back 6 months from now and some of the data has been updated, you'll see the updated data. So it actually does maintain current data. So that's a great way if you have a specific dashboard that you like to check out over time, or again, sharing with people. Okay, let's go back up to here to the filters. So our populations include things like adults, children, infants, LGBTQ. So if you were interested in a particular population, you could use this filter. Classifications are things like clinical care, health behaviors, health outcomes. So again, just another way of looking at the indicators that are available. Comparisons show all the indicators that have a specific comparison value. So as I mentioned, some of these indicators have target values. So if we were to click asthma plan target, we would only see the indicators with a target for asthma. So this is helpful, like if you wanted to see only the US states, the US value, or US zip codes. If you clicked that filter, then it would only show you indicators that have data with the comparison to the US value. I do want to show you an example of this because this is a really great functionality. So these are all of the different subgroups. So if you remember when we looked at teens with recent depression, we could see it by sex and race, ethnicity, and grade. So I'm going to go ahead and we'll look at alcohol and drug use. And just to simplify things, I'm going to filter it just to the state. So now we can see all of the indicators around alcohol and drug use that have data by race ethnicity, and it shows you the data by race ethnicity. So this is a great way if you're interested in a particular subgroup to be able to see the data actually broken out by that. And then this last one is to filter by sources. So this is filtered by data sources. So for example, say we're interested in Medicare and Medicaid services. So now we can search and it will show us all of the indicators from that data source, from the CMS. You can see that by default, it organizes them into these categories, these topics. You are able to turn that off in the advanced search options if you do not want to have them organized by topic. Now what you'll see is just an alphabetical list of all the indicators that are available. So that is how you use the filter by data source. So let's look at that second option that I mentioned, the hand-picking indicator. So for that, you click up here and it will carry over any filters you have. So you might need to go ahead and delete, and I'm going to turn the topic area back on. So let's say we were interested in internet access and usage. So we type in internet, and this is going to give us all of the indicators that have the word internet in the title. So we see the first two are about tobacco ads. That's not really what I'm interested in. But then, adults who access medical services and information. Yes. Adults with internet access, households, persons. Again, a few more tobacco ones. And here's just a general internet usage. So let's see what this dashboard gives us. So this is my list of specific indicators that I chose, and it is showing us all the data at first by state and then by county. Some of these I believe are available at an even smaller geographic area, so it would show you that as well. Let's take a look at what this looks like if we filter it by location. Say we're interested in Hawaiʻi County. Now you can see the data specifically for Hawaiʻi County, and you'll notice it added a new comparison value icon. So it added a comparison value to the state, in addition to US and the prior value in the trend. So these are our 5 indicators. But this filter by location actually pretty amazing, I think. So let's take a look at one zip code. So now we're seeing our internet variables by zip code. And you'll see here that it produces a county comparison value. You might also notice that there's only 4 indicators when we have 5 selected up here. What that means is that one of the indicators does not have data down to the zip code level. So it won't appear. But whatever is available will appear. So this is a great way to explore small geographies. Okay, and the last thing I want to show you, I'm going to go back to our filters. I am going to filter it by state just to make it simple. And I'm going to look at heart disease and stroke. So there's also the indicator location summary. So this shows you the list of all the indicators where the geographies that they're available for. But let's take a look at our topic of heart disease and stroke. So here we can see an alphabetical list of all of the different indicators around heart disease and stroke. If you wanted to order it differently, there are some options. So here you can see that alphabetically is the default. But say we wanted to look at it by descending value. So it separates out the percentages from the other rates. So it starts with, in this case, mortality. And you can see that the highest mortality is heart death rate, and then coronary heart disease, stroke. And then it gets into the values, the indicators that are relayed by percentages. And here too, it lists the indicators from the highest percentage to the lowest. So this is a great way to kind of pinpoint those indicators that might have a specific importance to your project. And there are some other options. You can, sort it ascending. You can also sort it by recently revised. So it'll give you the newest data first, and by comparison, which will show you a list based on comparison values. And now let's give you some time for some hands-on work. So take a few minutes to practice building your own custom dashboards using these prompts. Okay, let's take a look at these activities. So the first one is build a custom dashboard for prevention and safety for Kauai County. Let's go back to our advanced search. The hint on this one was to filter by topic, so we can actually start typing in our interest. And it wanted to see the data for Kauai. Now we can see all of the prevention and safety indicators available on the site that have data for Kauai. And the second part of the question asked, is the rate of adults who use seatbelts in cars higher or lower in Kauai than in the state? So we can see here in Kauai, the rate is 90.3, but in the state, it's actually 91.7. So the rate is a little lower in Kauai. Okay, the next question asked to create a dashboard with indicators from the National Survey of Children's Health. So I'm going to get rid of these. And I'm going to go to data sources, and I'm going to start typing National Survey of Children's Health. And now we can see all of the indicators available from this data source. Now, the second part of the question asks what geographies are available. So this is a case where we might want to look at this indicator location summary. This is going to give us a list of all the indicators and show us the geographies where those indicators are available. So you can see pretty quickly, this is actually an example of one of the data sources that we can only provide state level data for. The sample size is too small to allow calculation of county level data. So most of the time, the county level data is available, but there are examples of data sources where you can only get the state. And then the last question was build a custom dashboard for arthritis for the state. So we could check in topics. Is there a topic about? No, there's no specific topic about arthritis. So maybe this is a chance to hand pick our indicators and make sure you get rid of any other filters that you have set. So what I'm going to do is type in arthritis. And it's going to give me all of the indicators that have arthritis in the title. And we can see what that looks like. Oops, I think I still have it on the indicator location summary. So now we can see all of these indicators at the state and county level and all the geographies that they're available at. This did ask to create the dashboard for the state. So I'm going to go ahead and limit this by the state. The other question it asked is which indicator has the highest prevalence? So I'm going to go ahead and sort this by descending. And now we can see that adults with activity limitations due to arthritis has the highest percentage for the state. Let me go ahead and show you those answers. I do want to invite you to join us in August for our next coffee break. On August 5th at 11 a.m., we will be exploring the community report function on HHDW. If you have any questions, of course, please contact us at profiles@hhdw.org. So we look forward to seeing you in August when we will be looking at the community reports feature on hhdw.org.